Stay with me for the next few minutes and let me show you how our team can help you change your life. First, let me introduce your team of surgeons, which is myself and Dr. Tracy Pitt from the Cleveland Clinic. We're both board-certified surgeons who specialize in bariatric surgery, and weight loss is 100% of our practice. We're one of the most experienced teams in Ohio. Going into 2015, we performed over 1,000 sleeve gastrectomies, 1,000 laparoscopic gastric bypasses, and more than 4,000 gastric bands. We have 4 convenient office locations in Cincinnati, Northern Kentucky, Dayton, and Columbus to serve patients from all over Ohio, Kentucky, and Indiana. We do procedures at Journey Light, the Christ Hospital, and Jewish Hospital, which are all centers of excellence accredited by the American Society of Metabolic and Bariatric Surgery. All right, I want to start off talking about the disease of obesity and define what it is. Obesity is not just extra weight. It's not just a cosmetic issue. Obesity is a serious disease that can cause other serious medical conditions like type 2 diabetes. We define obesity clinically as having a body mass index of 30 to 40. We define morbid obesity as having a body mass index over 40. Here's the equation for body mass index. It's a complicated formula that you can plug your weight and your height into, and it'll give you a 2-digit number. Let's take a look at this body mass index table, and let's start off looking at a patient with a BMI of 40 who's 5 feet tall. In order for this patient to be in the category of morbid obesity, he or she only has to weigh 200 pounds. So that's not really that great of a number on the scale, yet this patient faces significant risk from excess body weight. What sort of risk are we talking about? Well, if we look at mortality ratio based on BMI, mortality ratio is simply a patient's risk of death from any cause. And we look at a patient who has a BMI of 40, that patient would have a mortality ratio of 2.5, which means that they are 2.5 times more likely to die from any cause than a patient of normal weight. And studies also show that patients who have a BMI over 40 typically have a reduced life expectancy by 7 years. The reason excess weight is so serious is because of comorbidities. I mentioned diabetes a few minutes ago. That's one of the most common weight-related comorbidities. So comorbidity is a disease that's caused or worsened by another disease. In this case, the other disease would be obesity. Here's a list of some of the most common weight-related medical problems that our patients face. Sometimes I'll see a patient who has all of these problems. Sometimes I'll see a younger patient who doesn't have any of these issues yet, but they see it in their mother or their father, and they want to do something about the weight before it gets to that point. But either way, the news is good, because if you look at the cure rates for all of these problems after surgical weight loss, you can see that the numbers are pretty impressive, which really only makes sense when you think about it, because we define these problems as comorbidities, so we know that they're caused or worsened by obesity. Why do people have surgery to lose weight? That's a simple question to answer. The short answer is that without surgery, you have about a 5% chance of losing a significant amount of weight and keeping it off in the long run. Through surgical weight loss, we're looking for permanent solutions to your excess weight.